around antibody testing and its role, essentially. The first thing I'll say is there's some information about the different kinds of tests and when they should be used and how they can be interpreted on our webpage at the Virginia Department of Health. I think the role of antibody testing is we're still learning about that. So I think the best thing to do, is definitely work with your individual healthcare provider who's provided that test to you. But I think, Mel, in general, we're still learning about the role of antibody testing, and I think we're all equally eager to have additional science there.
What would you say to people who have already received a positive test result? Let's say I spoke to a woman yesterday who went to Quest, and within 24 hours she had a positive result. What would be the guidance to somebody like that?
Denise, Tony. Dr. Tony, do you want to chime in there at all?
Do you want me to take a shot?
Yeah.
So Mel, the question is what to advise someone who's had the serology test, the antibody test, who's been tested positive, and what kind of behavior they should have. Now, implied in that question is the idea that if they had what we call an IgG result, which normally would indicate that someone is immune to whatever they were exposed to in the past and that they no longer have the infection. If you tested me and you would find out that I'm IgG positive for chickenpox, it's not likely that I'm going to get chickenpox again because of that antibody. As Dr. Furlano just explained, we don't know if that's the case with COVID-19. There's conflicting evidence on that. And so my advice to someone, and I would do this myself, if I had a positive antibody test to COVID-19, I would still be obsessive about washing my hands, covering my face when I'm in public and I can't be socially distant, and practicing social distancing in other ways. In other words, acting as though I could still get COVID-19 because we don't know whether or not having IgG to COVID-19 protects you at this point.